Good afternoon, and thank you for joining us for our introduction to HPIO's Health Value Dashboard. I'm Nick Weislegel, Communications Manager at HPIO. We've developed a series of tools from the dashboard, and they're all available on our website, www.hpio.net. And the slides for today's webinar are also available in the events section of our website if you'd like to review them later or share them with colleagues. Because of the large number of callers we're expecting today, all phones have been muted. We're going to start with HPIO staffers Amy Bush-Stevens and Reem Alley giving an overview of the tool, and after that there will be time for questions. Please feel free to type your questions in the comment box, and we'll try to get to as many as we can. And now here are Amy and Reem.
All right, thank you very much, Nick. We are delighted to have so many people on the webinar today to be able to share the Health Value Dashboard with all of you. We actually had a wait list for a webinar for today and tomorrow, so we are most likely going to be adding another session of this webinar, so stay tuned for that. So our goal is that by the end of this 45-minute webinar, you will know where to find the dashboard materials and how you can use them in your own work. That you will understand the purpose of the dashboard and how it was developed, and how it differs from other rankings and scorecards that are out there. And most importantly, that you'll know how Ohio is doing in terms of health value. We are going to end with questions, but as we go along, please go ahead and type in questions and comments in the chat box as you think of them. We want to know that you're out there and that we're not alone. We hope that as you become more familiar with the dashboard, you'll think of many ways that you can use it in your own work and share it with stakeholders. So you can use the dashboard to prompt discussions with policymakers about health value and about the many factors that impact health. So for example, just last week, I was meeting with a state senator, and I was able to use the dashboard as a way to get a conversation going about the relationship between health and education. You can also use the dashboard within your own organization for setting priorities, because the dashboard highlights several areas where we really need to improve in Ohio. You can also use the dashboard as a list of metrics. So if you're working on any projects in your own organization where you're developing a dashboard or evaluations or quality measurement, you can look to our list of 106 metrics as a place to start when you're trying to find the metrics that are out there. Towards the end of the session, Reem is going to give a tour of the dashboard materials that are on her website. You'll see we have, you can download the Ohio data in an Excel file. There's a place where you can order hard copies of the dashboard and other tools. And we really welcome your feedback on other ways that we can present the dashboard materials in a way that you can use and incorporate in your own work. So please type in your suggestions as we go along. All right, so now I'm going to talk about the purpose of the dashboard and the process that we went through to develop it. First, I want to acknowledge our Health Measurement Advisory Group, which is listed here. We would not have been able to produce the dashboard without their input and guidance. And we worked this group pretty hard. This was not a rubber stamp kind of group. They really did homework where they sifted through the metrics, attended countless meetings and conference calls. So we really appreciate their contributions. So why did we create this dashboard, and why this focus on health value? First, it's important to keep in mind that our primary audience is state policymakers. And we know that policymakers are concerned not only about the health of Ohioans, but also about healthcare costs. So the concept of health value really resonates for them. And we also find that health value is a unifying concept that a wide range of stakeholders care about. So when we frame the end goal of improved population health and sustainable health care costs, we find that it begins to pull different groups together and spark some really interesting conversations. So for example, since we have released the dashboard, there have been lots of questions about why healthcare costs are so high in Ohio compared to other states. And we hope that this is going to lead to some really productive conversations for Ohio. Second, we wanted to create a tool that would help policymakers to track our progress toward health value over time. So it's really about answering the question, are we there yet? We knew this needed to be something concise and visual and really put data into context in a way that would be relevant for policymakers. So that's why we use the dashboard format. That's why we use the rankings, which serve as kind of a hook to help get people's attention, and lots of graphics and the red, yellow, green coloring to really simplify and tell a story from what is an incredibly complex set of information. So the dashboard is really designed to be something that can be taken to policymakers to prompt conversations about where Ohio is doing well and where we need to improve. So we started this journey by first developing a conceptual framework with input from the Health Measurement Advisory Group. And we started that by first looking to existing population health frameworks, like this one from County Health Rankings and Roadmaps, which was very helpful. America's Health Rankings has a similar model. So we looked at those models first. We also looked to the triple aim, which includes per capita cost. And cost is something that is typically missing from traditional population health frameworks. So you can think of our conceptual framework as really kind of a mashup of the triple aim and the traditional population health model. There are two really important things to notice about this framework. So the first is that the endpoint is improved health value, as I already mentioned. And the second is that the 5 domains to the left include factors both inside and outside the healthcare system. So this dashboard is not just about healthcare system performance, but it's about these other factors as well. This is another view of the conceptual framework, this time with programs and policies listed to the left. And in our next phase of work that we'll talk about at the end of the webinar, we're really going to be focusing more on what happens here to the left. All right, so a little more about our process. Once we had our conceptual framework, the next step was selecting the metrics. So we had these 6 work groups, and each work group was charged with selecting 15 metrics for each domain. And we started with lists from the existing scorecards like Commonwealth, State Scorecard, America's Health Rankings, and County Health Rankings. And then we looked for additional metrics to fill in the gaps that weren't covered by those sources. We have a set of decision criteria that we used when we were combing through these metrics, and that is listed in the full version of the dashboard PDF. In the end, we selected 106 metrics, which is a lot. All right, the next step of the process was to contract with the University of Cincinnati Economics Center, and they compiled the data and ranked the metrics. Before I turn it over to Reem to talk about the key findings, I want to say a little bit about what makes this dashboard unique. So I've mentioned that the dashboard builds upon existing scorecards and rankings, like the ones that are listed here. And we were also very careful to include a wide array of stakeholders in this work so that whenever possible, we were aligning with and being mindful of other things going on in the state, like the State Health Improvement Plan and the State Innovation Model, or SIM, plan. On this slide, the existing data sites are listed across the top, and then along the left are the domains from our conceptual framework. And as you can see, population health and healthcare system performance and access to care are really well covered in a lot of the sources that are out there, but there's much less of a focus on cost, the physical environment, and public health. So there are 3 things that stand out as being unique about this health value dashboard. So this is a key takeaway for this webinar today. The first is that the dashboard focuses on cost, includes cost. Second is that it's comprehensive in terms of the determinants that are included, so it's not just about the healthcare system. And third is that it uses a format that's intended for a policymaker audience. So now I'm going to turn it over to Reem to talk about what the dashboard shows us about how Ohio is doing.
Great, thanks, Amy. So
before I talk about the dashboard and the different parts of the dashboard, please feel free to chat in your comments or type in your comments into the chat box. We're going to be monitoring it, so if you have a question or have a comment that you'd like to make, feel free to use the chat box to share that. So as Amy described, the past 2 years, our work has been guided by the question, how will we know if we are successful in achieving improved health value for Ohioans? So to assist us in answering this question, we developed the Health Value Dashboard. The dashboard itself is a tool to track Ohio's progress towards health value, comparing Ohio's performance to other states. Where possible, we track change over time, and also include information on best state performance and health disparities or gaps in health performance across Ohio's subpopulation. So to orient you to the dashboard, I'm going to quickly walk you through its different parts. The dashboard is divided into 7 domains. Ohio's health value rank comes from the equal weighting of population health and healthcare costs. You can see Ohio's rank on population health, healthcare costs, and Ohio's overall health value rank on this overview page. Throughout the dashboard, you will see that green indicates performance in the top or best quartile, and red indicates performance in the bottom or worst performing quartile. On this overview page, you can also see Ohio's rank on the subdomains within population health and healthcare costs. So, for example, in the healthcare cost domain, we have the subdomain of total spending, where we rank 36th. That domain is comprised of the metrics overall healthcare spending per capita and spending growth per capita. In the population health domain, you have the subdomain of overall health and well-being, where we rank 38th. And you can see that the metrics included in there include length and quality of life. The dashboard also provides a summary of how Ohio ranks on the other 5 domains that impact population health and healthcare costs. And Amy mentioned these, but this includes access in the healthcare system, as well as the other factors that impact population health and healthcare costs, such as the public health and prevention in Ohio, and our social, economic, and physical environment. Within the dashboard, you will also find a snapshot of Ohio's greatest health challenges and strengths. Here we highlight the metrics where Ohio ranks in the bottom quartile, or in the red, or in the top quartile, in the green. We also provide a quick reference at the bottom of the page for subdomain ranking. And you'll note here that we have no subdomains that rank in the top quartile for Ohio. This particular page provides us with a starting place for where we can identify and begin to implement strategies to improve Ohio's performance, specifically around these health challenges or bottom quartile metrics. In the dashboard, we also provide a snapshot of disparities for Ohio's greatest health challenges. So that would be adult smoking, infant mortality, and adults diagnosed with diabetes. We wanted to highlight the importance of addressing disparities or gaps in health outcomes across different subpopulations. So here we identified the outcomes for which we performed the worst and displayed by race, ethnicity, income level, and also broke down by county level in Ohio. In that box, the closer look box, we include a link to a crosswalk that lists all 106 metrics, and where available, provides links to sites where the data for the metrics can be broken down even further by race, ethnicity, income level, or sub-state geography. So it links to sites such as the Robert Wood Johnson Foundation RWJS Data Hub, or County Health Rankings. We also include domain profiles in the dashboard, which provide a closer look at each of the 7 domains. These domain profiles include the state rank for each metric, a rank for subdomains, data values for most recent and baseline year, trend, so indicating are we getting better, are we getting worse, or have we stayed the same, and then also the best state value to provide some context on how much Ohio needs to improve to be ranked more highly. On these domain one-pagers, we also include a breakout graphic that highlights disparities for a featured metric or set of metrics. So for example, here we have gaps in life expectancy and then gaps in healthcare preventable deaths. We also, of course, have the appendix, which discusses our process that Amy talked about, our rankings methodology, metric selection criteria, lists out the Health Measurement Advisory Group workgroup members, and has a table with all the metric sources and other more specific descriptions of each of the 106 metrics in the dashboard. So now that we've walked you through the different parts of the dashboard, how does Ohio do? As most of you have already reviewed the dashboard, you will have seen that we rank 47th on health value. We are not getting good value for our healthcare dollar. Ohio has high healthcare spending and poor overall population health outcomes. So this means that while we spend a lot on healthcare, we are not seeing the spending translate into good health outcomes for Ohioans. You may wonder how our rankings are similar to America's Health Rankings, Commonwealth State Scorecard, and the Gallup Healthways Wellbeing Index. When you take a look at our population health outcomes domain, which is that second row of health outcomes, and similar domains in other scorecards, you can see that we rank across the board about 40. Where we differ is in our overall rank. So the HPIO dashboard is focused on health value. We're not just talking about overall health outcomes or healthcare system performance. So since we place a heavy emphasis on the sustainability of healthcare costs, the end result is for us that we are just not getting good value for our healthcare dollar. We're looking at health outcomes and healthcare costs, weighting them equally, which leads us to an overall health value rank of 47. So how do we compare to other states? On the, I think it's the left side of the screen for you all, the highest value states are Hawaii, Utah, Colorado, and Idaho. These are states in the top quartile for both population health and healthcare costs. Ohio is joined by Indiana and West Virginia as one of the lowest value states. And in that intersection, these are the states that are in the bottom quartile for both population health and healthcare costs. So I wanted to share with you the map of population health rankings. And if you see any patterns in this map, feel free to type them into the chat box. But I'm just going to give you a second to take a look at this map and excuse me, and kind of observe and see if there are any patterns that you can discern. You probably won't be surprised that the West Coast states tend to be better performing, so those are the ones that are in the green, and the southern states are poorer performing, they're in the red and orange.
As one person in the audience says, wow, Midwest not doing well.
Right. So there's some geographic patterns that you can notice with this population health map. Now this is the map of healthcare cost rankings. Again, I'm going to give you a moment to just take a look at this and see if you observe any patterns. When you look at this map and think about the population health rankings map, it appears that the healthcare cost rankings are much more variable and tend to be a bit more dispersed geographically. So not all of the southern states are doing poorly, and not all of the West Coast states are doing well as far as low healthcare costs. And finally, we have the health value ranking map. One of the questions we've gotten is, why are some states in the South doing better than Ohio on health value? Because we are looking at health value, some states fare better than Ohio because they either have better population health outcomes or spend less on health care. Because Ohio does poorly in both areas, that brings our overall health value rank down. One of the other questions we've gotten is age driving the health value rank, or is poverty driving the health value rank? And we did do a correlation analysis with the UC Economic Center to see what the correlation of age and adult poverty and child poverty were on our health value rank, and we found the correlation to be between 0.2 and 0.3. So while age and poverty do have some correlation with the health value rank, that correlation is not very strong. Clearly, there are other factors that are impacting the overall health value rank. And that leads us to our next slide of why does Ohio do so poorly? And ultimately, there are many factors that impact population health outcomes and healthcare costs, and unfortunately, Ohio performs poorly in many of these arenas. The public health and prevention and the healthcare system in Ohio face significant challenges, and Ohio also struggles when it comes to the other factors that impact health, which include our physical, social, and economic environment. It's important to note that the majority of our healthcare spending is on clinical care received within the healthcare system. Far fewer of our dollars are actually spent on public health and prevention. At the same time, our social, economic, and physical environments combined, not the performance of our healthcare system, are actually the largest contributors to our overall health outcomes. So here you have in front of you Ohio compared to Utah on the metric of adult smoking. Utah is the best performing state. So we're at 23.4% and Utah is at 10.3%. And just to take a look comparatively, you can see on tobacco and smoking related measures, Ohio tends to do more poorly than Utah, well, a lot more poorly than Utah. So youth all tobacco use is at 21.7% for Ohio, at 5.6% for Utah, at 10.3% for Ohio, for children exposed to secondhand smoke, and at 1% for Utah. Now, interestingly, when you look at the public health and prevention metrics and compare them to compare Ohio and Utah on the related smoking metrics, you can see that there's a difference in some of the policies and interventions that they've implemented in Utah. So the Utah cigarette tax is about 50 cents higher than Ohio's, and then tobacco prevention spending in Utah is clearly significantly higher than Ohio's. So what this tells us is that these are not the strategies necessarily to combat adult smoking, but certainly we can learn from other best performing states on these metrics, and this begins to tell us what types of strategies other states are implementing and what strategies we may want to consider implementing in Ohio. This is just a reminder that we'd love for you to get engaged in the conversation, so if you have any questions or comments, please feel free to type them in the chat box. I also want to show you on our website where you can find our dashboard materials. Taking a second for it to load here, so hopefully you can see my screen. This is our home page, so if you want to go to the dashboard, you can click on View Our Dashboard here. And you can find a number of different tools and resources related to the dashboard. So here we have our complete dashboard that includes the appendix, methodology, and sources. We have a 2-page overview, and that has that overview page and then the why does Ohio rank so poorly on health value page. We also have a 4-page overview, which includes a snapshot of Ohio's greatest health challenges and strengths and a snapshot of disparity. We have the state ranking map that I showed you in the presentation. We also have frequently asked questions about the dashboard. And we have the Excel spreadsheet that Abe mentioned where you can download Ohio data. And if you would like to look more closely at the data values, metric description, as well as kind of a more detailed look at the different metrics, you are able to do that and manipulate the data in your own work. We have the domain profile one-pager. We have information about our webinars. And then we have the share the dashboard. And this is something I encourage you all to do, which is to go here and to request copies of the dashboard. You can request full hard color copies of the dashboard, or you can request copies of the 2-page version and 4-page version of the dashboard. And this would come to you in color, and it's free if you for a limited time and for limited requests. So we encourage you to come quickly to this site and, if you're interested, request a dashboard. So with that, where do we go from here? Our aim is that the information presented in front of you serves as a catalyst for creating policies, alignments, and partnerships that will move us out of the red and into the green as a high-performing state and health value. These rankings are meant to be a starting place that clearly outlines our strengths and challenges and gives us a yardstick to measure change over time. The dashboard provides us really with what is a baseline to track Ohio's progress towards improved health value, which we hope to continue to update and track over the coming years. And with that, I'm going to hand it over to Amy to talk a little bit more about our next steps and what we'd like to do with the dashboard going forward. All right, thanks, Green. I'm going to talk about how we're getting the word out and what we're doing to continue to build upon this work and improve it, and how you can get involved with that. So first, we are spreading the word through presentations, in-person presentations, these webinars, and one-on-one meetings with legislators. Soon we're going to be launching an online commentary series called Voices for Value. So we're inviting thought leaders at the state and national level to comment on the concept of health value and to generate ideas for improving health value in Ohio. And we would love to have your help in spreading the word about the dashboard. So you can do this by including a link in a newsletter or an email to contacts, and by posting a link on your website, sharing hard copies of the dashboard with legislators or with others.
Real quick, we got a question come in. Is there county level data for all the metrics you have for the state?
That's a great question. Unfortunately, there is not county level data for all of the metrics, but what we've done is created a crosswalk, which is on the dashboard page of our website, that shows you which metrics are included in county health rankings. And so you can get to county level data for some of the metrics through county health rankings. And then there's also local regional data available for some of the metrics through the Commonwealth local scorecards, and we have a link to that as well. So to the extent that that level is available, that data, local level data is available, we've tried to provide links to that. All right. So another thing that we're doing with the dashboard for our own organization is using it to set priorities. So in December, we convened a group of stakeholders to look particularly at this page from the dashboard, so focusing on the greatest challenges for Ohio, and then prioritizing where there were areas where HPIO could really add value and not duplicate other things that are going on in the state to improve health value. So based on this discussion, we have so far prioritized tobacco use, behavioral health access, and food insecurity and healthy food access. So stay tuned for more information from us on these topics over the next year. Another thing that we are hoping to do is to really expand the dashboard to include more information about health disparities and health equity. We're also interested in doing deeper dives on healthcare costs and non-health sector spending and how that impacts health value, and other additional analyses that are prompted by discussion and questions from folks like you. So if you have ideas, please type them into your chat box. And finally, we're really interested in looking at what happens to the left of the conceptual framework. So we're going to start tracking how state-level policy changes impact the systems and environments in the middle of the conceptual framework that affects health and ultimately affects health value. So we want to be partnering with others to look at alignment and gaps in alignment between things that are happening in the public and private sector that impact health value. So you can see some of the examples of possible ways of looking at that on this slide. We are going to get to general Q&A in just a minute here, but first I wanted to pause for a minute and see if anyone has sent in comments about how they plan to use the dashboard. So I'm going to give you a second here. Hopefully we have inspired you to think of some ways that you can use the dashboard either for your own organization, possibly setting priorities, maybe for community health assessments, or in some kind of alignment with state-level work that's happening. Anyone have a creative idea? or something they might be exploring.
All right, well, while you think of that, feel free to type in your questions or any questions that you may have into the chat box, and we'll address them.
All right, and so as you're typing your fabulous questions and comments, just want to take a moment to thank our funders. So this is a list of our core funders for HPIO. And then these are two funders who have invested specifically in the dashboard work, Cardinal Health, and then PHI is helping to support some of our work to follow up on next steps with the dashboard. All right, so we have arrived at the question and answer portion. We have a few questions here.
Actually have some comments on how the data is going to be used in the dashboard, or how the dashboard is going to be used. So we have somebody who hopes to use it in their community health assessment, which is wonderful. I think that, as Amy indicated, you can use the dashboard metrics as a starting place, and then the links that we provide to get the county level data.
Oh, and I forgot to mention another really great source for the county level data, which is Network of Care. So many of you on the call are probably familiar with Network of Care. It's a new data website hosted by Ohio Department of Health, and we have a link to that as well. So many of our metrics are also in Network of Care, and Network of Care in turn provides that data at the county level and sometimes at the city level. So it's actually designed for local health departments. And we will continue to work with ODH to build that out and to have more overlap.
We also have another question. Have you thought about using the media to, went away my question. Have you thought about using the media to perhaps do a series on the dashboard to help educate citizens of Ohio on this important information? And I'm going to let Nick Weislow, our communications manager, take the lead on that question.
Yeah, when we initially released the dashboard, we did include approximately 200 media contacts that we have on our media list with the initial rollout. So members of the media have been informed, and we've had a little bit of media coverage, but our plan is to kind of continue ongoing outreach to media. The timing of the release, kind of at the end of the year around the holiday season, might not have been the best to get a lot of media attention. So through this next few months, I think we're going to continue to reach out to media. That's certainly something we're interested in, trying to get a little more traction with the media. And so, yeah, that's something that we're continuing to look into. And we'd also ask any stakeholders that have local media contacts who might be in touch with a local reporter, please direct their attention towards the dashboard. Any help we can get spreading the word would be greatly appreciated.
Thanks, Nick. And just to add to that, Amy mentioned our Voices on Value commentary series, and that's where we're going to have online commentary. We don't want to call it a blog because it's likely not going to be updated on such a regular basis. However, we will have it frequent enough to be valuable to you all. But that's another way to have some thought leaders in the state and potentially outside of the state as well to comment on the dashboard and to talk about the different ways that the dashboard can be used and the importance of measuring health value.
All right, so we have another question here. In addition to looking at their demographic and policy differences, are there opportunities for the top-ranking states to share best practices? So that's definitely one of the things that we're considering doing as a next step, is to really look at those top-ranking states and see what are they doing that we're not doing, particularly in terms of state-level policies. And so we're hoping to be able to get to that.
Right, and part of our next steps are to do that specifically for tobacco use and smoking and behavioral health access. We're going to be doing a kind of a preliminary environmental scan on policies that are being implemented in these best states, as well as food access and insecurity, healthy food access and insecurity. Any other questions?
Questions, ideas, suggestions, deep thoughts.
So one of the questions that we have, or I guess comments, so to speak, is that there is a lack of reporting in the dashboard in regards to multicultural competency initiatives within Ohio. And so one of the limitations of the dashboard is that we're using metrics that were publicly available and that were, to the greatest extent, nationally recognized
and available for all states.
So we are certainly interested in learning more about other metrics that could reflect Ohio's progress on things like multicultural competency and diversity initiatives and other initiatives that may impact our overall health value rank. So if you have ideas on what metrics we should include in the dashboard, please feel free to contact Amy or myself.
Yeah, or you can type into the chat box. But that's a great point, because one question that no one has asked yet, but people often ask is, when will you release the next edition of the dashboard? And most likely we'll be updating this every other year, depending on the availability of resources. But when we do our next update, we're definitely going to be looking to folks like you all on the call today to give us suggestions for other metrics that either we missed in our initial review or new metrics that may become available. So please send those to us, because we definitely want to make sure we're reviewing all the possible metrics.
Another question, Amy, earlier you mentioned that you had the opportunity to talk to state legislators about the dashboard. I think the first one should go into a little more detail about what the reaction was, and do you foresee this tool impacting current health policy within the state?
Sure, yeah. Well, we actually had an earlier kind of preliminary version of the dashboard a year and a half ago that we initially took to legislators just to see if it was something that they would be interested in. And they were very interested, because they felt like it put all of the information together in one place in a way that was helpful to them, since they're very busy folks. But we have found that it's a great way to introduce the idea of all the determinants that impact health with legislators. Some of them may be more focused on health care when they think of health policy, and so we have found it as a really good way to kind of start that conversation about the importance of the social and economic environment and physical environment. And once we start to have those conversations, they usually they get it, and they feel that those things are important as well. So that's been useful. We've also seen, legislators will often kind of zero in on some specific things, like infant mortality, because we do rank so poorly on infant mortality, and also the tobacco-related metrics. So those are just ones that really, I think, stand out on the dashboard as being shockingly bad for Ohio.
And one of the things that we should also mention is that there is a data lag on some of these metrics. And so some of the policies, especially the policies that you're seeing in just the past year or so to address infant mortality and to address smoking and tobacco use, what we've done is we've created a baseline to track Ohio's progress with this dashboard. And so hopefully in the next iteration, we will see some progress, which hopefully we can attribute to some of the policies that Ohio is currently in the process of implementing.
Okay, another question we have is, with smoking cessation efforts directed by county health departments, how can this information impact more the implementation of smoking cessation policy? It says some counties provide programming without really evaluating the efficacy of long-term quit rates.
All right, that's a great comment, because actually as a result of the dashboard, we've decided to focus more on tobacco policy and cessation specifically this year. And so we're actually planning a forum on this very topic of tobacco cessation that we're planning to have later this spring. And we'll be bringing in some experts on tobacco cessation to really talk about what are the most effective measures and how can we measure the impact of cessation programs. And we're really interested in looking at how local health departments or FQHCs or others who are doing smoking cessation programs, how we can align any kind of outcome evaluation or quality measurement that you all are doing with the metrics in the dashboard to really build out that left side of the conceptual framework. So that's a great example. All right, it looks like we don't have any more questions. However, if you have questions that you didn't want to share in the chat box or just had further comments for Amy or I or the rest of the HPIO team, feel free to reach out to us. I think we have a slide with our contact information. Maybe? No, we don't. There we go. So feel free to reach out to us. We very much appreciate you all joining us today, and look forward to working together to improve Ohio's overall health value rank. Thank you. Have a great day.